We're still all awake, I'm sure. Thank you very much for coming this afternoon. As Myra was saying, we're very glad to see so many people. When we all were arrowed to do this, okay. Yeah. In fact, in particular this session actually, we were asked, okay, who's going to come? So we said, okay, I put my name. The next thing you know, you have to present. So then when I look at it, I said, hey, how come only a few of us presenting and not everybody? But anyway, okay, I'm very glad to be here to share with you what we have done, all right? And not very much actually, certainly not much for my topic. I'm a surgeon, so surgeons are not very clever people. We just go straight to the point and do what we do, all right? So I'm going to actually go through this really in the so-called CPG way, okay, which is what I thought I should be doing. So I'll not be giving a big lecture on smoking on it because I don't know much about it. And we'll be just telling you what we have found in the literature and what perhaps might be useful in your clinical practice when you're deciding whether to sink in the implant for the patient, all right? So firstly, on smoking, all right? Now, first thing, as you know, as I say, I do not know very much of smoking because I spelled cigarette wrongly, because I don't smoke myself. In fact, I didn't even know that a cigarette has so many stuff, right? Look at all these guys. Wow, I saw this in the internet anyways. Nowadays, with internet, you can do a lot of things, right? So you can find a lot of information. So if you look at the cigarette itself, they have so many different types of components. So, of course, we all talk about nicotine, right? Oral cancer is one of my past life, or in fact, present life, so I still do quite a fair bit of it. But certainly, we talk about a lot of nicotine and its effects from cigarettes. But the thing is, it's not just nicotine. You have all this stuff that comes with it, all right? And we know that if you smoke, okay, you produce a lot of toxins, okay? And basically, we all know about the heart disease and stuff, right? But why is it that smoking, or what is the problem with smoking, right? Now, basically, as I say, I'm not going to give you a long lecture, so because a lot of this stuff are also, I think we all know, right? Some simple words. We just want to know that when you have smoking, you introduces oxidative stress to the body. What does it mean? It just means that you actually make the body more susceptible to inflammation, all right? And oxidative stress can cause all sorts of stuff. Okay, inflammation itself is a very complicated topic. I still remember when I was doing dentistry and did the course by Prof. Shamugam on inflammation, right? And then after that, I was doing my medical school, and we talked about inflammation. Wow, things are so different. They have so much more cytokines, whatever, that come in, and I'm sure now is much more as well. But what we want to know is that we have smokers and people who smoke will contribute to some oxidative stress to the tissues and cause tissue damage. Okay, and then problem with repair. So we all know if you smoke, your powers of healing are bad, right? So that's simple, right? Something easy to understand, even for a surgeon like myself. But what is really the problem with smoking? The problem with smoking is really related to the arteries, okay, most of the time, all right? And in fact, if I'm not wrong, they actually affect both the big vessels and the small vessels, okay? And big vessels are, of course, your heart, and you have a problem with, coronary artery disease as well as the fact that if it affects small arteries, you can give Buerger's disease, which is actually related to small vasculitis, right? And arterial diseases are hidden. You do not actually see them. So when you see a smoker, you don't really know, that he has a lot of this disease underneath, unless he tells you, right? So the history of smoking is actually quite important. And that's actually what I want to emphasize, that we do not know actually what's wrong with this guy if he smokes, right? So he has a lot of problems. What are the problems? Okay, so this is again from the internet. So for some of you, you may just spot the deformed sperm as the first thing, right? But I think we should all see that the main thing is actually related to the lungs, the heart disease. Okay, you can have, of course, dental tooth decay. Some of you have perhaps, right? And of course, oral cancer, something quite close to my heart. And certainly, we have wrinkling, hearing loss, osteoporosis, emphysema, heart disease. We mentioned earlier on, stomach ulcers as well. Cervical cancer and Buerger's disease, microvasculitis. Now, the thing is this. It is multi-systemic, right? So if someone smokes, especially if he smokes for a long time, then it's quite likely that he may suffer from many of these, perhaps, okay, or maybe not. Because in fact, my dad used to smoke, and he always tell me, no problem with me. But unfortunately, he died of a heart attack, right? So certainly, this is something that we have to be aware of. We have to understand that smoking causes long-term damage, just like diabetes. In fact, when you start first being diagnosed with diabetes, right, you may not think that it's really serious, right? But actually, as we all know, it gives you lots of problems: the eyes, heart, lungs, everything. So it's the same thing with smoking. So if a patient has been a smoker, then the next thing in history you want to know is how long he's been smoking, right? And how much he's been smoking, okay? So the history itself becomes quite important. So if you say he just take a fag every now and then, and a young chap just coming through the door, maybe he don't have a deformed sperm, right? But certainly, for someone who has been smoking for a long time, and he will have all these microvascular vascular diseases, which will affect your healing. And in general, that's something we have to understand, okay? So the thing to remember is because it's actually very important, because it actually goes now to the next topic, right? Which is actually, of course, something close to our field. We talk about oral tissue. So we know that smoking can give you more periodontal diseases, okay? In fact, 2 times higher risk of periodontal diseases, both increase in frequency as well as also the severity. You have bone and tissue loss because of damage to the tissues. Of course, the tooth loss itself, related to perhaps upon periodontium and also bone loss. And also this issue of peri-implantitis and implant failures, which is actually what I'm going to talk about. And this is why actually the work group decided that we want to talk something about this in the CPG, right? And if you remember what I have told you earlier on about smoking with multi-systemic disorder diseases, then you understand why it's going to be difficult, right? So in fact, when we were doing this study, it was very difficult because if you look at all the papers, there were a lot of papers talking about smoking, and just like Ansgar was telling you about hyperbaric oxygen and all the stuff. There were just papers, and this guy will say some things and is successful, whatever, and another guy will say something. But what the important thing to note is that it's not really a very sort of a homogeneous population. So when we want to study something, we want to study something similar all the time, then you see whether there's a cause and effect, right? So unfortunately for smoking, people have other diseases, okay? And they can be all sorts of diseases, be it a deformed sperm, or you get fingers problem, whatever, right? So certainly, this is a problem, especially diabetes and osteoporosis. We know that they actually impact on your implant success rate as well, right? So if a patient has been smoking, then you can't really say that the success rate is not high just because of smoking. So it's very difficult to actually prove that. And it's actually reflected in the papers that we look for, okay? And I must say, where's Andrew Au? Andrew, where are you? Okay, Andrew Au is my partner in crime in this, so we actually went through the papers, right? And we tried to look for a lot of papers that looks and pretend that we are very busy in front of Shilun, right? But certainly when we look at it, it was very difficult to understand, wow, how much of this is really good stuff, right? Because we are talking about producing a guidelines for you guys, for everybody in Singapore, then we want to know that we're not telling you bollocks, right, and bullshit, huh? And certainly you want to know that what we say is something that's supposed to be according to the level 1, 2, 3, 4, 5 evidence, things like that, right? And we want level 1 evidence, we don't want expert opinion, right? Things like that. It's all rubbish, right? So certainly it's very difficult. Okay, so if you look at actually the CPG itself, and that's what Ceylon has been trying to emphasize. You have to read it with a pinch of salt. Not that you don't believe it, but you must look at the level of evidence, the grade of recommendation, because this is what it's supposed to be, right? So we don't want to pull any wool over your eyes. We want to tell you, okay, what has been found, right? So for papers and studies that has been on smoking, it can be very difficult to determine whether how much of it is actually really attributed to smoking and not anything else, right? And certainly, like Ceylon's example of jumping down the airplane, there's no such thing as a randomized double-blind controlled trial, you know? How can you do that in smoking and implants? No way. As in actually many areas of practice, okay? So that's why this thing about evidence, sometimes we got to be sensible. So maybe the evidence that we see a lot of in what Myra has told you, mini implants for is perhaps maybe good enough evidence. But of course, it's something that we have to be sensible about.